So after they've had maybe, unfortunately, a failed IUI or even a transfer, the thought of having to go on all the medications again and having to figure out what's going on with them, it's traumatizing. It eats away at their self-esteem, their self-confidence, their sense of self, their sexuality, their identity as a woman in the world. And unlike a broken bone, like a broken arm or a broken leg, women tend to take the diagnosis of infertility as a sense of that they are fully defective as a whole, not as a part. Mm-hmm. They don't look at like, okay, my uterus or fallopian tubes or whatever else is going on needs support and help from a doctor. And it's something they need to show up to get diagnosis, whether it's a septum, fibroids, endo, or bigger, like they have to start going to immunologist or a hematologist, and get more information and blood work and things done to see what else is happening in their bodies. But they tend to globalize this diagnoses as kind of an attack, a narcissistic attack, really, on them. It's a wound. It's a narcissistic wound to their identity. And if we can help women see that, look at all the other things that are working well in your body. It's not your uterus and your fallopian tubes do not define you in this world, and that they're diseased or something's going on that needs support and help around it, and trusting, hopefully, the doctors around them to, delve in and figure it all out for them.
Hard to trust other people when you're in a
absolutely
traumatized state.
Yes.
And when we're in a traumatized state, the hypothalamus isn't behaving properly, might be sending confusing messages down to the ovaries because it feels like survival is threatened.
Absolutely. Nothing feels safe. They can't. That's a good point. And I agree completely that they have trouble trusting and knowing if that person's, that's why they turn to the internet, for example, like Dr. Google, and want to second guess, the doctor and maybe self-diagnose. And that's part of the trauma. That's a symptom of trauma. They're trying to make sense of and gain control and agency over something that feels completely out of their control and disempowering. So they're turning to Dr. Google, their self-esteem, self-confidence, their sense of concentration and focus can show up as irritability and depression, anxiety, and they lose sleep or sleep too much. A lot of symptoms show up, and it's usually hyperarousal, and their hippocampus shrinks by 20 to 40% in trauma, which is where we retain new information and hold on to memory. So that will recover over time, but the hippocampus is also involved.
When that hippocampus is shrinking, it seems like that's akin with closed-mindedness, right? Because then they start isolating.
Right.
They start having the same repeated thoughts of it's happening easy for them, or like I'm broken or something, and the ability to think big picture, like if I can calm down, if I can take a step back, if I could be patient and give it 3 months to like heal, then so that's the hippocampus.
Yeah.
Interesting.
Yes. Also, the heart is involved in this. The heart can, one of the valves of the heart can enlarge during trauma, and it gives them, that's where the palpitations, panic attacks, anxiety, that's real. That's a real symptom.
Physiological.
Absolutely. And then, I always love your example of how the uterus is the second heart, and how we have to keep the heart feeling good and upbeat and hopeful, because if we're not good in the heart space, we're not going to be as good down here.
The uterine space.
Yeah.
Yeah. And the uterus in Chinese medicine pertains to ovarian function and the whole 9, Yeah.
So, diagrams, which I know you love to use, would be thoughts become beliefs, which become emotion.
Yeah.
And then that dictates your behavior, action, words, and choices in the world.
Yeah. And maybe even your outcome.
Right. And your outcome. So part of my job as a psychologist is to help people go backwards and go back to the brain and go, okay, sorry for this. In psychology, we call it distorted. I know some of the things that we call older women in gynecology isn't so positive either. But anyway, distorted beliefs, distorted thoughts. How can I help them move to neutral or positive in that area and actually put it in black and white to help them at home with a journal? I actually give them a little journal, or if they already have one, great. I call it our little workbook, and we use that in the sessions, and they have to bring it to the sessions and take notes, or I give them homework or whatever. But the point of this is the mindfulness piece. And the mindfulness piece is, what are your thoughts? What are you thinking? And how are you feeling when you think these thoughts? And getting really curious with the feeling and having them close their eyes and just center, and I ground them. And we work with emotions, and then we use color. I ask them to give that emotion a color and a shape. I'll just simplify it for the podcast. And then to put another color around that and behind and around it, and to mix the two. And to watch in their mind's eye what happens, and let me know when the shape dissolves and when the color has completely mixed in and become the outer color. And the outer color represents their etheric body. So what I'm doing is empowering them by saying, you have it within you to heal and calm down your nervous system. You don't need something outside of you to help calm down your nervous system. But that's just a piece. There are things that outside do help, such as temperature. So there's something called sympathetic shock that women tend to go into, and they don't realize they're in sympathetic shock. And I help them learn to tune into knowing when they're in shock. And that will be numbing out, disassociating, having a sense of derealization, can't think, can't feel even. They can't even name a feeling. That's sympathetic shock.
Wow.
And teaching women how to treat their shock. They need to treat it with hot or cold. Usually temperature is the best. So ice, I tell them to go to the freezer, put ice on the back of their neck or their chest, or they hold it in their hands, or use heat with a heating pad, or drink something hot, or you take a hot shower. But that's how you treat shock. So even taking a ice pack to doctor's appointments, and having it ready if they need it in the exam room, and put it on them before the doctor comes in, so that helps them stay focused on the sensation of the cold, is keeping them grounded and present.
That's brilliant. Yeah, because so much trauma happens in those conversations, right? They receive so much bad news, they can't even look at the ultrasound machines.
Yes. That's a whole nother.
Yeah.
That could be a podcast.
That could be its own episode. Yeah. So it's like using temperature and maybe putting the ice pack on the head, like in Chinese medicine, the thoughts go rushing up to the head.
Sure.
So
there are ice caps. For people who get migraines. So you can buy one off Amazon too.
That energy going upward. So what do you call that with respect to shock?
Treating it.
So just
treat your shock so that you're literally taking care of yourself so that you can remain present with what is or what's happening.
And so that's when there's like an acute thing that's happening and it's looking like shock. And then PTSD, that's like this chronic disappointments that feels like shock, but may not necessarily be shock, but it's just more like, oh God, here's more bad news. Here's more bad news.
Right.
And so then it's about integrating the trauma into the person as a whole.
Well, it's recognizing and separating out the trauma symptoms so that they can recognize that oh, I'm irritable today because I'm exhausted and burned out from constantly worrying about my fertility and if I'm good enough, or being on that hamster wheel, as I call it, of woulda, coulda, shoulda, what if, only if, the Dr. Google stuff, the obsessive thinking to regain a sense of empowerment. So the sympathetic shock has more to do with past their thoughts, actually. It's really their thoughts and then the emotions that come up based on whether that's a discussion with a doctor or just they're alone and they're feeling isolated in this process.
They can feel panic attack coming on.
Yes. Mm-hmm. And how to treat that.